Hello, I'm Dr. Emily Carter, a urologist, and today I want to have a calm, professional conversation with you about something many men experience, but rarely talk about openly. If you're a man over 60 and have recently noticed that your climax feels different, that the sensation of pleasure is still there, but no semen appears, I want you to listen carefully. In this session, we will look at what happens during a normal climax, what might cause the absence of semen, and what medical science can do to help. The goal is not just to fix a function, but to help you regain peace of mind and confidence in your body. Before we talk about why semen might not appear, it's important to understand how the process works when everything functions normally. Your body is a highly coordinated system. The testicles produce sperm. The seminal vesicles add nourishing fluid that gives semen its volume, and the prostate gland contributes its own protective fluid. These components come together inside the urethra, preparing for release. When climax occurs, a chain of events unfolds within seconds. Nerves send signals that cause muscles around the pelvic area to contract rhythmically, pushing the semen outward through the urethra. It is a precise and automatic process where multiple systems work in harmony: the nerves for control, the glands for production, and the muscles for propulsion. This coordination creates what most men experience as a single, seamless moment of pleasure and release. However, few people know that orgasm and ejaculation, although they usually occur together, are technically two different things. The orgasm is the neurological sensation of intense pleasure. It is the body's way of signaling climax to the brain. Ejaculation, on the other hand, is the physical act of releasing semen. Most men experience them at the same time, but they are separate mechanisms. This distinction matters because it helps explain why you might feel pleasure, even when no fluid appears. When you experience the familiar sensations of climax but notice that no semen is released, that condition is known as dry ejaculation. It can be temporary or recurring, and while it might feel unusual or incomplete, it is usually not dangerous. Still, it can trigger deep concern. Many men describe it as an empty orgasm, something that feels satisfying but also strangely incomplete. That sense of absence can cause emotional stress and self-doubt. Understanding that the pleasure pathway remains intact is crucial. Your ability to experience sensation, arousal, and satisfaction comes from your nervous system, and that remains functional. The issue lies in the mechanical side of the process, not the emotional or neurological side. This difference is key. It doesn't mean you've failed, and it doesn't mean you've lost your ability as a man. It simply means that one part of your system has changed its behavior, and every change has a reason. Once we understand that reason, solutions become much clearer. There are several possible explanations, and most of them are manageable once identified. One of the most common causes of dry ejaculation is something called retrograde ejaculation. To understand it, imagine a small valve located at the exit of your bladder. During a normal climax, that valve closes tightly so that semen is directed forward and outward. But if that valve doesn't close properly, the semen takes the easier route backward into the bladder instead of exiting through the penis. The man still experiences the pleasure of orgasm, but the semen never leaves the body in the usual way. Often, a man may notice that his urine appears cloudy after intimacy, which happens because semen has mixed with it. This condition can occur for several reasons. Surgeries involving the prostate or bladder, particularly those addressing benign prostate enlargement, can sometimes affect the nerves that control that valve. Certain medications, especially those prescribed for high blood pressure or mental health, can also relax the muscle that's meant to keep the valve closed. In other cases, long-term conditions like diabetes or spinal cord injuries can interfere with the nerve signals responsible for this process. I remember one patient who came to me deeply worried after a prostate surgery. He thought the absence of semen meant he had lost his virility. When I explained to him that his desire, pleasure, and performance were still intact and that the change was purely mechanical, he felt an immense sense of relief. For many men, that understanding alone restores their confidence and allows them to reconnect with their partners without fear or shame. Diagnosis for retrograde ejaculation is straightforward. We usually confirm it with a urine test taken after climax to check if semen is present. If it is, that confirms the fluid is flowing backward into the bladder. Treatment depends on the cause. Sometimes adjusting medication is enough. In other cases, we can strengthen the bladder neck or use targeted therapies to restore normal function. It may affect fertility, but it rarely prevents a fulfilling sexual life. Most importantly, men can still experience full pleasure and intimacy even when semen is redirected. This is one of the reasons I tell my patients never to panic about changes like these. The body doesn't stop working, it simply adapts. And understanding that adaptation gives you control again. Another possible reason for dry ejaculation is a blockage in the pathways that transport semen out of the body. Think of your reproductive system as a network of small, coordinated channels. The seminal vesicles located behind the bladder produce most of the fluid that gives semen its volume and texture. This fluid travels through delicate ducts that merge with sperm from the testicles before exiting through the urethra. When one or more of these ducts become obstructed, the flow of semen can decrease dramatically or stop altogether, even if sperm production is normal. It helps to picture it like traffic on a busy road. If the highway is blocked, cars can't pass, no matter how well the engine is running. In the same way, a blocked duct prevents the semen from reaching its destination. These blockages can form for a variety of reasons. One of the most common is a past infection, especially untreated prostatitis. Inflammation from infection can leave behind small scars that narrow the passageways through which semen travels. Over time, those scars can act like a partial barrier, restricting flow. Another possible cause is the formation of small calcified stones inside the seminal vesicles or the ducts themselves. These are similar in nature to kidney stones, though much smaller, and they can block the passage of fluid. In some men, cysts or structural variations that have been present since birth can also narrow these channels. Each of these factors can interfere with the natural outflow of semen. Symptoms of obstruction vary. Some men may experience mild pelvic discomfort during climax, or notice that their semen becomes thicker, darker, or less abundant over time. Others might feel normal during orgasm, but find that the quantity of semen has quietly diminished month after month. Because the symptoms can be subtle, many men don't realize something has changed until the absence becomes complete. The next area to consider involves the hormonal system, which plays a far larger role than most people realize. Testosterone, often described as the engine of male health, doesn't just influence sexual desire. It regulates sperm production, supports the prostate and seminal vesicles, and affects nearly every step of the reproductive process. When testosterone levels decline significantly, which can happen naturally with age or as a result of other health conditions, the entire system begins to slow down. At first, a man may simply notice a reduction in semen volume. Over time, however, other symptoms can appear, including lower libido, softer erections, a less intense orgasm, fatigue, and mood changes. Some men even notice a gradual loss of muscle mass or motivation. It's common for men to dismiss these changes as normal aging, but that's not always accurate. In many cases, this pattern points to a condition called hypogonadism, which means the body is not producing enough testosterone for its needs. In my clinical experience, one of the most transformative moments occurs when a man realizes that his ability to experience pleasure, to connect emotionally, and to express love has not been taken from him. The presence or absence of fluid does not define intimacy. Intimacy is about connection, awareness, and mutual trust, and these are fully within reach when information replaces fear. At this point, it is worth emphasizing how intertwined physical and emotional health are. Stress, anxiety, and shame can actually worsen sexual dysfunction by tightening muscles, lowering testosterone, and interrupting nerve communication. This creates a feedback loop where worry amplifies the very symptoms that cause the worry. Breaking that cycle begins with accurate information and open dialogue. A single honest conversation with a doctor or a partner can restore clarity and confidence. Medical evaluation for dry ejaculation typically involves a few simple tests. A urologist may perform a urine analysis, hormone assessment, or imaging study depending on your history and symptoms. Beyond the purely medical side, there are practical lifestyle adjustments that can make a real difference. Regular physical activity improves blood circulation and supports healthy nerve function. A balanced diet with sufficient zinc, magnesium, and healthy fats promotes hormonal stability. Limiting alcohol, avoiding tobacco, and ensuring quality sleep are all proven to support male reproductive health. These small steps, while simple, can have significant cumulative effects on overall well-being. So if you take only one message from this talk, let it be this. Don't let embarrassment or hesitation stand between you and clarity. Talk to your doctor, take care of your body, and share what you learn with the men you care about. Every conversation helps remove the stigma surrounding men's health. The more we speak openly, the stronger and healthier future generations will be. If you found value in this message, please share it with a friend, a brother, or a father who might benefit from hearing it. Leave a like so that this information reaches others who need it. And subscribe for more discussions about men's health, confidence, and longevity. Remember, good health is not only about living longer, it's about living fully, with energy, peace, and pride. I'm Dr. Emily Carter, and I want you to know that your best years are still ahead of you. Stay informed, stay proactive, and above all, stay healthy.